Hello, my name is Dr. John Wessling, and I'm a chiropractor, and I've been in practice here in the Wichita area since 1975. And in our office, a part of our practice is for the treatment of peripheral neuropathy. Now first let me say that your nervous system is divided into two broad categories, and the first is your central nervous system, consisting of your brain and your spinal cord. And then the second one is all the other nerves in your body, the ones going down your arms and down your legs, and also all of these internal organs here. Okay? And they're part of what we call your peripheral nervous system, which includes sensory nerves that receive feelings such as heat, pain, or touch, your motor nerves that control how your muscles move, the autonomic nerves that control automatic functions such as your blood pressure, heart rate, pulse rate, digestion, and bladder function. Now most of the time, peripheral neuropathy is characterized by numbness, tingling, loss of sensation, weakness, pain, and decreased sensitivity to temperature in your hands and feet, as well as difficulty in walking. Now the known causes for peripheral neuropathy are diabetes, especially if your sugar levels are poorly controlled, and know that diabetes is responsible for many causes of peripheral neuropathy. Now another cause is a herniated disc in your back. Another factor is poor nutrition and vitamin deficiency leading to metabolic imbalances. Also immune system suppression, which occurs in people who have had multiple surgeries or who have received a organ transplant. Another cause could be autoimmune diseases. These are conditions where nerves have mistakenly attacked your own body's own immune system, such as rheumatoid arthritis and lupus. Also any kidney, liver, or thyroid disorders. And last but not least, another big contributor to peripheral neuropathy is side effects to certain medications. So as you can see, peripheral neuropathy has symptoms with many potential causes. And for this reason, it can be difficult to diagnose. So to help diagnosis, we offer brain-based therapy. So what do? Well, we check you neurologically. We are going to do specific tests to check your cerebellum and brainstem. Now the cerebellum is located right here, and here is your brainstem. Now your cerebellum controls your balance and coordinated movement. It also controls all of your postural spinal muscles. So if you have any tight contracted muscles that is causing spinal problems, say here in your lower back, this may compress the disc and then be pinching the nerves that are going down your legs here into your toes. Another reason for neuropathy may be caused by an overfiring of the upper brainstem. The brainstem is here. This is the upper part, and there are three parts actually: the upper and the middle and the lower. And normally your brain fires impulses down to the lower 2/3 of the brainstem, which then slows down the upper brainstem. Now when there is a loss of electrical impulses to the lower 2/3 of the brainstem here, the upper brainstem will become overexcited or overfire, and the result is a numbness, burning, or tingling. Now all of these sensations are perceived in your brain. So how do we know this? Well, we do tests. And some of the tests we do is we have you stand with your arms to your side with your eyes closed to see whether or not you may sway or not. That's one test. Another test is to bring your arms out in front of you with your eyes closed, and we bring your finger toward your nose. Now if your finger ends up here in your cheekbone or up here in your forehead, then we know that the cerebellum and the brainstem are not working correctly. Another test we may do is called past pointing. You take the index finger, you point it above your head, close your eyes, and you bring your index finger in the opposite hand and bring it up and you touch. Now if your finger ends off in front or behind, then we know that the cerebellum is not working correctly. So these are tests that are done to see how well your cerebellum and brainstem are functioning. Now also, we will check your tendon reflexes, muscle strength and tone, your posture, your coordination, We'll also evaluate your ability to detect vibration, light touch, body position, temperature, and pain to help reveal any sensory nerve damage. And this may help indicate whether you may have small or large sensory nerve fibers that are affected. Now, also because of the risk factors that contribute to neuropathy, like glucose and sugar imbalances, poor nutrition and vitamin deficiencies, liver and thyroid disorders, we are going to treat you metabolically as well. All too often, you may not realize that what you do to yourself and what you eat causes you to have inflammation, which will stimulate and irritate the sensory pain nerves in your arms and your legs, even though the pain is referred from somewhere else. Now, our specialty comes into play by looking at your entire body, your nervous system, your cerebellum, your brainstem, but also your metabolism and diet, because in a lot of cases that is the contributing factor in causing peripheral neuropathy. Now, in our office, we take a holistic approach in the treatment of peripheral neuropathy by incorporating metabolic and specialized therapies that are safe, non-toxic, and highly effective. Now, if you suffer from peripheral neuropathy and you are looking for a doctor that will sit down with you to find out who you are, how you have been treated, and be able to provide you with some hope, then please fill out the area below for an online video that will explain in more detail all the different therapies and treatments that we do that make our care so unique and successful.